This segment of Delmarva Life is brought to you by Peninsula Home Care.
They are the leading cause of deaths and disability in this country. Chronic disease is basically a disease that lasts 3 months or more.
Now, we talked about one of them just before the break, lung cancer. But there are so many other chronic diseases. According to the Department of Health, Alzheimer's classifies as a chronic disease, as does arthritis, asthma, cancer, diabetes, heart disease, even obesity, and tobacco use.
So how many people are affected? Well, the Centers for Disease Control and Prevention reports as of 2012, about half of all adults, or 117 million people, had one or more chronic health conditions. And the CDC reports 1 of 4 adults has 2 or more chronic health conditions. Well, maybe you're one of the millions of people living with a chronic illness. You can take an active role in managing it.
Joining us today to tell us how is Therese Ganster, who's the community liaison with Peninsula Home Care. Thanks for coming in.
Thank you.
So we're talking chronic diseases. Honest to goodness, we really can self-manage?
We can, and we should.
How?
How can we self-manage? Well, first of all, we need to understand the difference between chronic disease and chronic illness or chronic conditions. Okay? The disease portion is where people often are afraid that they're going to, as the kids would call it, get the cooties from, that it's contagious, okay? Or that there is no hope or in solving the process. The disease management portion also is where our physicians are key, because they're the ones who come up with our treatment and our medications that are going to help with that process. But what the condition portion of that is the symptoms, all of the things that happen with that condition or that illness. And how can we control those symptoms to have a better, healthier life and become more independent?
All right, so why is self-management important to patients?
It's important because it gives them control. It teaches them life skills and lifestyle changes, and they can break down what absolutely can work for them. An example would be, we all know that we're supposed to drink 8 glasses of water a day. We also know that that helps with all of our possible diseases that we've listed earlier. But many of us don't like to go to the bathroom. We might be traveling a lot. We might be too active, or we just don't like the taste of water. So how can we break that down? How can we make it, is it first something that's achievable? Is it something that they want to do? Do you want to make that water come and be able to drink? Okay, so I'm going to decide that I'm going to drink a glass of water when I first get up after I brush my teeth. I'm going to drink after every meal. I'm going to have another glass of water at bedtime. You almost have your 8 glasses in and you don't even think about it.
Do you think people have a hard time self-managing?
Absolutely. Absolutely. I think the hardest thing for us is to feel that we can break it down into action plans, know what those decisions are, and how to communicate to others that we can do it and that our caregivers can help us with that.
And that's why Peninsula Home Care is holding these self-management workshops. Tell us about them.
Absolutely. We partner, okay? It is a Stanford University program, and our Maryland branches have been doing this for almost a year now, and they have partnered with MAC and PRMC and some of other key areas, and they have progressed greatly in that process of providing those services. I live in Delaware. I live in Sussex County, and the trainers are just beginning to become more enveloped in Sussex County. Kent and Newcastle have been doing this with the training with the Division of Public Health for a very long period of time. We're trying to get the word out to Sussex County so that they know that these are available.
So what kind of things would we learn?
What would we learn? Well, we would learn our weight management. We would learn problem solving, action planning and goal setting, mind-body connection, which is your stress management relief. Medication use and management, which is very important. Communication, not only with your physician, which is very important, but with your loved one and your caregiver. And that becomes key in us trying to manage our skills, because many times we're frustrated. People don't hear what we're trying to do, and they don't understand where we're at.
What kind of tools are going to be used at the workshops?
The tools. Let's talk about a self-management tool process, but we have, before we go there, we're going to go to the symptom cycle.
Okay.
These are the conditions that we were talking about, the symptoms when we're trying to work. You can start that cycle at any place. So let's talk about shortness of breath. You're having difficulty breathing, and you maybe don't have your medications in tow, and you don't know exactly how to take them correctly, or you're doing more than you should be doing. Causes fatigue.
Okay.
The fatigue causes you not to be able to sleep, and it goes on and on.
Now let's get to tools.
The tools are a toolbox.
Yeah.
I love this, okay? If you see, our key one is highlighted with action planning. These tools are the things that will help you work through the conditions that you feel are the most difficult, the
How about
symptoms
that?
that are the most difficult.
Okay.
Cerise, thank you. That is awesome. And the workshops are free.
They are free, and please call our office. We would more than happy if we can get 5 from a senior center, church group, anywhere. We will get that group together and start working in the 6-week program.
All right, Therese, thank you so
Thank
much.
you.
And to read more from Peninsula Home Care or to learn more about the upcoming workshops, go to wvoc.com and click on our picture at the top of the page.